Hi, welcome back. Today we're gonna explain the pharyngitis. Pharyngitis, let's look at this word. Itis, it means inflammation. And pharynx means the pharynx. And it's anatomical anatomical site in our body. Here is the pharynx. And it's divided to 3 subgroups: nasopharynx in the nasal, oropharynx in the oral, and laryngopharynx in laryngeal. So this is the pharynx, and pharyngitis, it means inflammation of mucosa on the pharynx. So what is the symptom that the patient come with it? The symptoms, it's dry throat, coughing. The patient come with cough. He said that his throat is dry and he cannot swallow, difficulty in swallowing, and his throat is hurting. Or another name, sore throat. So what is the sore throat? Simply it means that your throat is hurting. Simply mean your throat is hurting. So what are the 2 pathogens that cause pharyngitis? Let's go and know it. First one is viral cause. And we should know that the viral is most common. The viral cause is most common, such as viruses in common cold may cause pharyngitis, and viruses in mononucleosis may cause pharyngitis, like Epstein-Barr virus. Let's repeat it. The viral is the most common cause, such as the viruses in common cold or mononucleosis, and the other pathogen is bacterial cause. But we should know that the bacterial cause is more serious than viruses, because if we do not treat it, we go in complication. And these complication called Group A Streptococcus complication. But first, let's recognize what is the pathogen that causes bacterial pharyngitis. It's called Streptococcus pyogenes. Streptococcus pyogenes. So what is the name? Streptococcus pyogenes, or we could call it Group A Strepto. So it has 2 names, Streptococcus pyogenes or Group A Strepto. On agar, we should know that the Group A Strepto, it make beta-hemolytic. So if we put this bacterium in agar, it will make appearance. We call it beta-hemolytic. So let's repeat it because these are important information. Bacterial, it's Streptococcus. What is the pathogen that causes bacterial pharyngitis? It's Streptococcus pyogenes. This is the most common. It's called also Group A Strepto. And on agar, it shows a beta-hemolytic Group A Strepto. So because these bacteria cause symptoms in the throat, we have another name for it. What is this name? It's named strep throat. What's the third name for it? Strep throat. It's more serious infection. If we not treat it, it's lead to a complication. What is this complication? The complication, we will see abscess, where we will see it in peritonsillar, and we will see otitis media. And the most important 2, rheumatic fever and glomerulonephritis. Let's repeat the complication. You should like this information, you should copy it in your brain. Complication: abscess in peritonsillar, otitis media, rheumatic fever, and glomerulonephritis. So this is the Group A Streptococcus complication. How do we diagnose it, or how do we know this pharyngitis is caused by viral or bacterial? How do we know if it's caused by virus or bacteria? Let's know. If patient comes with sore throat, his throat is hurting, dysphagia, adenosphagia, pain at swelling, difficulty in swelling, and there is a redness. There is a redness. So, if we see exudate, what's mean exudate? Like you open his mouth and you see white or yellow patches in the throat, patches like pus, material like pus, colored by white or yellow, you should suspect on bacterial. So you do this test. It's called rapid antigen test to confirm your testing. If it's negative, so rapid antigen test, it will give you two reasons, negative or positive. If it's positive, so it's bacterial and it's a streptococcal pharyngitis. How do we treat the bacterial? We treat the bacterial by giving him penicillin. So the treatment of choice is penicillin. But what if it gives you a negative? If it gives you a negative, we should not say it's a virus. No, you should do another test. And this test is throat culture. Always, after the negative testing in rapid antigen test, you should follow it by throat culture. If the throat culture is positive, so it's a streptococcal pharyngitis, and you should give him penicillin. If it's negative, it's definitely a virus, a viral cause. And we say in virus cause, we treat just symptomatic and suppurative treatment. Let's repeat it. How do we know? By test. It's called rapid antigen test. Rapid antigen test, if it's positive, so it's a streptococcal and we give him penicillin. But if it's negative, we should do another test before it confirm it if it's virus or not. We should not do another test. It's called throat culture. If it's positive, it's bacterial. If it's not, it's definitely a virus. So sometimes we could know it's virus by the cough and rhinorrhea, conjunctivitis, oral ulcer. These things we could, if it's present, we should know it's a virus. So we obtain a rapid streptococcal antigen testing, as I say it. Then if it's negative, we do throat culture, or from the beginning we do throat culture, because the throat culture is gold standard. We also say in bacterial we see exudative, like patches, yellow patching if you open his mouth. We also see a cervical adenopathy, the lymph node is enlarged. lymph node enlargement. And these things is highly suggestive for Streptococcus pyogenesis. Thank you guys for watching the video. Please subscribe to my channel and put a like.